I'm a member of the Portland chapter of the Democratic Socialists of America, and we believe that healthcare is a right. We believe that everyone in this state and in this country should be able to go see a doctor. So we know that when our elected officials do not stand up for Medicare for all, that there's a reason. Usually it's money, and it's lobbyists who are paying them to not stand up for Medicare for all. So our question is, when are you going to stand up and support Medicare for all? Support the Senate bill right now, 1804.
You started this off exactly right, and you have laid down the line of demarcation in terms of somebody's position on health care. I definitely believe health care is a basic human right. I definitely believe that everybody ought to have access to quality, affordable care. And I'm going to spend a little time kind of walking through this because this is such an important topic. And for me, it's always been my biggest interest. Healthcare ought to be a basic human right. Every person ought to have good quality, affordable care. To me, the most important thing going forward is lowering the out-of-pocket health expenses for working class people and senior citizens. There is a health care bill, the Wyden bill, Elizabeth Warren and myself, in terms of restricting the amount of co-pays that you could put on the consumer. Now, I have made the judgment that there also ought to be an opportunity for all Americans to participate in a Medicare-based health system. It's going to take a lot of work, and I've discussed this with many folks who support the Sanders bill. What will be done to the 161 million people who get employer-based coverage? We better have an answer to that question.
Maybe they should recognize that the overhead costs are much lower, 2% versus 20% and sometimes much more in private insurance health care. That's more than a fifth of our health care dollars simply wasted, a waste that disappears with Medicare for all.
And I would like to work very closely with you. We will assign a staff member to work with you. This is not like he showed up at a meeting and said a bunch of things and that was it. I want to make it clear that I want to see a choice for Americans to participate in a Medicare-based healthcare system so that every single American has quality, affordable healthcare is the #1 priority